Hey y'all, my name is Raven Chapman, and I am going to be presenting my final project today. So let's go ahead and jump right in. So, me and my group interviewed a healthcare assistant. Her name is Laurel Hammond at the Planned Parenthood Wilmington Health Center. Planned Parenthood is a clinic. It's actually a non-profit clinic that provides sexual and reproductive health care. Um, the mission of the clinic is to ensure broad public access to sexual and reproductive care, education, and information. So, I'm going to go ahead and talk about the needs assessment strengths. So, the first strength that we identified was that the clinic offered a wide range of accessible services. So, this includes abortions, birth control, pregnancy testing, STD testing and screenings, gender affirming care, and HIV services. The second strength we identified was inclusive, diverse patient care. So, this clinic sees people of all ages, all genders, and all backgrounds. The third strength we identified was that the staff was very knowledgeable and adaptable. So they're well trained, they're aware of like the changing laws, and they have a really good ability to adjust care as like the political and social conditions shift. Um, so these are the needs and problems we identified. I listed five. There were a couple more, but I thought these were like the big ones that we saw. So the first one is misinformation and lack of accurate sex education. So we noticed that a lot of patients or people outside of the clinic were coming in with incorrect information based on things they've seen on social media and etc. And then there's also been poor sex education in schools, so students are not receiving the appropriate information that they should be. So and then there's just general misunderstandings about anatomy, birth control, and reproductive care. And then social stigma is our second one. It's where patients experience fear of judgment around abortions and a gender affirming care, which can discourage people from seeking needed care. Um, then there's limited access to care, so costs like if insurance, follow up appointment requirements, and stigma make it hard for individuals, particularly gender affirming patients, to access consistent, safe, and affordable care. Then there's the political and legal barriers. So this is like the changing abortion laws, restrictions on federal funding, and shifting healthcare policies that create instability and reduce access to care. Then there's your weak community support and outreach. So New Hanover County is really not partnering enough with Planned Parenthood. So there is a need for stronger public health presence and community outreach. So now we're going to go into my evidence-based infographic. So this is my infographic that I made. It's kind of silly looking, but it gets to the point. I named it Breaking the Stigma, and it's about sexual and gender health awareness. So the problem is misinformation and stigma around sexual and gender health, and then the cause is because of social media influence and lack of education. The goal is to provide accurate, inclusive, and trustworthy health education, and the intervention is through CDC guided health education outreach programs and campaigns. And the expected outcomes: increased awareness, reduced stigma, improved trust, higher encouragement, and inclusive community environment. Some of the strengths of my infographic include credible and evidence based guidance through the CDC, clear identification of main barriers, so misinformation and stigma, and then I have a strong target audience for adults between 18 and 30 and transgender individuals. Next, I have my logic model. This one's pretty complex, so I'll just go over it pretty briefly. But the intervention type that I chose with health communication, and the intervention title, I decided on Mythbusters. I thought it was fun, but it got straight to the point as well. So, communicating health facts in our community. So some of my inputs include partnerships through local media, healthcare organization, funding through social media ads, media airtime, other materials, staff, which would include like the social media managers, public health communication specialists, and health educators. And I would get my credible health data through the CDC or the World Health Organization. Um, for my outputs, my two activities. My first one was social media campaign, which will share like accurate evidence-based information to debunk myths regarding gender affirming care and sexual health, which will be supported by evidence explaining how misinformation spreads and strategies to share accurate health information. And this will be through community members between the age of 18 to 40 or 18 to 30 who use social media platforms, individuals who are seeking accurate medical information. The second activity is collaboration with local media outlets to host myth busting segments featuring healthcare professionals, supported by evidence that health and misinformation is widespread across social media platforms. The participation for this is community members who may rely on radio outlets rather than social media platforms. So, individuals between the age of 18 to 65, but mostly looking at senior ages. Um, the first short term outcome is increased knowledge and awareness of how to avoid and identify health misinformation. The second outcome is going to be increased ability to recognize and question misinformation on social media. The medium term outcome, the first one, is increased knowledge and awareness of how to verify health information. And then your second medium term outcome is going to be a greater community engagement with credible health sources and reduced sharing of inaccurate information. And my long term outcome is going to be reduced spread of health misinformation and increased community trust. So I know that was a mouthful, but that is the logic model that I put together for my project. So moving forward, this is the evaluation objective and design portion of the project. So, my objective is to measure whether a 2 week sexual and gender health education program improves knowledge. The goal is for 70% of participants ages 18 to 30 to correctly identify at least 4 myths on a 12-item misconception quiz compared to their pre test scores. The outcome variable of this is to score at least or score on a 12-item sexual and gender health misconception quiz measured before and after the program. The design is a quasi experimental, so it's a pre-test post-test design, which is going to have an intervention group and a comparison group. The intervention group takes pre-test and then it completes a 2 week program, and then it'll take a post-test. And then the comparison group will take a pre-test and a post-test without receiving the program, which will allow for comparison of knowledge and change over time, so we can see how those two compare, if that makes any sense. And then the evaluation method is to compare the pretest versus the post-test results, and the objective is to see if it met the 70% of participants show improvement by correctly identifying 4 or more myths. So yeah, and that is all that I have. So thank you for listening to what I had to say, and I hope you can take something away from this. And I'll have a question in my discussion board for you to answer. So thank you. Have a good rest of your semester and happy holidays.